Hello, and this is a sample of the CrystalTear report. And what I have pulled up is a full report where we have a lot of imaging done on this particular report as a full examination. So for example, we have tear meniscus height, tear breakup time, a dynamic video looking at tear film debris here coming up the tear film, looking at oil slick on the eye with a video with blinks, scleral imaging, looking at lashes, looking at blood vessels there, doing some staining with lissamine green, fluorescein pattern, looking at the papilla there, conjunctival chalasis, looking at blinks here, looking at those marks, and meibomian gland expression. You will be able to customize your test, and what you're essentially doing is showing a patient there's more than one area of dry eye that we are assessing here. Here is the aqueous deficiency category, and under this particular category, we did a tear meniscus height and we did some upper lid margin staining. And what we can do is go ahead and score the right eye and the left eye individually. If I have this check mark, I have my right eye and left eye both appearing on here instead of one eye at a time. And then I will be able to score them both at the same time. So if I were to decide that there was going to be mild instead of moderate, it'll go ahead and populate the mild category for this particular assessment item that I'm looking at. I'm going to jump down to meibomian gland deficiency, and here we have another set of imaging photos that we've done to examine this area of the tear film. Most popular to look at is the meibomian glands, and I'm going to go ahead and open up the exam into our Genvis grading scale, and I will be able to go ahead and drag and move the patient's imaging here to the appropriate grading that they fall under. I can do the upper lid, I'll be able to do the lower lid, and the lower lid you see a little bit of puffiness there, some faint meibomian glands here, some shortening, but they're not as pronounced as they could be in healthy. With each category, like meibomian or inflammation, we have a set of recommendations that we will also be able to customize. You can also have check mark boxes that'll have a mild, so it automatically defaults certain check marks here, a mild, moderate, severe, and we'll go over that in just a moment. Here's a sample of the inflammation category. So here are all the images associated with inflammation. And if you want to pick up lissamine green or do some staining, you can add those to your imaging, taking advantage of the different magnifications of camera on the system, different lighting to look at different areas. Blepharitis, you can do videos, pressing on the glands to do recordings. And here on blepharitis, the treatment or the recommendation treatments are different down below. In the end, essentially what we're doing is we're going to be giving the patient a report. So what I will do is go ahead and pull up a sample of the CrystalTear report. So for each one of these categories, we're going to show the patient what areas are problematic versus mild areas versus moderate areas. And for each category, I can show them the recommendations that were on our checklist down below on the actual testing. And here's inflammation, showing me again those recommendations, allergy, lid function. But this is all based on, the report is based on what you decide to capture and what you decide to assess. We do give you some defaults, so let's jump over to the customization editor. So you have full, abbreviated, follow-up, and what you'll notice on the full, like more of the bold printouts for each one of these categories. On the left side, on the right side are all the capture items that will be done for the full dry eye protocol. On abbreviated, not as many assessment areas under each category. less testing that has to be done, and follow-up. You've given patient treatment. Now I want to just measure tear meniscus height. I want to look to see on the tear film dynamic video if there was improvement with bacteria. I want to look at the lipid layer after I've done either a MIBO expression or the patient has done a Bruder mass, just to compare whether or not there is more oil film on or colorful oil film on the tear film layer. And a redness scan, perhaps looking at any inflammation or lack of inflammation or clearing up of any kind of problem that the patient was having. So I can add an assessment, and I can add a test to the right-hand side. And as you add an assessment, it'll highlight areas that it suggested to go ahead and do those particular testing. So I'm going to go ahead and exit out of here, but I've already renamed a test here. So I called it abbreviated 2, so it wouldn't be so bad. So once you customize those, it'll be here up in the screening right here as well. And that's pretty much sums up just a quick overview of the CrystalTear report. And I thank you for taking your time to take a look at it.